We're going to continue talking about this schema today, and it really sets a trap for clients in terms of a cognitive bias that makes them interpret the world in a way that becomes really unhelpful and makes it a hard schema to shift. I'm Ruth Holt. I'm an advanced trainer and schema therapist.
And I'm Rita Younan, a clinical psychologist, also advanced schema therapist, supervisor, trainer. And yes, we're here having our part 2 series on emotional deprivation, one of the really big common schemas that we see in therapists as well as our clientele. And you're right, one of the hardest things with this particular schema is that people tend to hone in on how they're not being seen, how their emotional needs aren't being met, how they're not attuned to, how they're not understood. And part of the work is really starting them to get them to see how those things are actually happening in the way that they need, but maybe not necessarily in the way that they want. And that is probably a really good distinction that we should talk about today. And Ruth, you had a really lovely example of some of the ways in which this comes out with some of the couples that you see.
Yes, you can. I mean, I'm often seeing couples that are not happy, obviously. And one of the things that can happen is there's a dynamic developed that somebody with an emotional deprivation schema will perpetually be looking for those moments where they're not seen, where the person doesn't get them, where the person maybe doesn't even read their mind. So you might have someone, whose partner brings in a cup of tea to kind of, look after them after a hard day, and they might respond with, I just need space. Why do you not know what I need? Like, get out of here. And, at one level, of course, it's okay to need different things, but what they're doing in that moment is kind of confusing the need and the want. And in a way, kind of saying, you need to get the bullseye. You need to know exactly what it is I want and what I need. And if you don't get that, it's not love. And so we really challenge clients in that moment to start to go, is it in the ballpark? Is it an expression of love? It might not be the bullseye, but is it in the ballpark? And I think that terminology can be something they can use and catch in that moment when that angry side is about to explode, to kind of go ballpark or bullseye, and maybe starting to make some room for ballpark acts of love. And I mean, you were saying, earlier today, Rita, there can be a lot of anger when it comes to emotional deprivation that we do have to help clients with.
Absolutely. So sometimes this schema does correlate with anger, and so it might trigger an angry child mode, that part of the patient that feels really angry and resentful as a result of not being seen by people in their world. And so they might view themselves as giving, 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 but no one ever sees to see them and give them back in the same way. And so some of the things that you might want to do is give voice to the angry child, perhaps in a mode dialogue of some sort when it comes to a particular situation, and help them to get to a point where they can perhaps see reason, if you like, but also validating that emotional experience that they have. And this is something that you can also do in imagery. Perhaps it's, going back to a memory where they really aren't seen, and encouraging them to connect with the part of them that feels really angry about what's happening in the image, even though it may have not have been the intention of, good intended parents to ignore or to make them feel invisible when they were just working hard trying to provide, for example. But the anger is okay.
Yeah, it's a really interesting area, isn't it, to start tuning into that child mode, the angry child mode, the vulnerable child mode, and even conceptualizing as you're working with a client, how old is that child? If it's a very young little angry child or vulnerable child or both, the interventions we're going to do need to be targeted in that younger way. So really giving clients a much stronger felt sense, a bodily sense of connection, love, nurture. So for example, if you're doing imagery rescripting with someone who has got that big emotional deprivation schema, but they're quite young, you want to think about how if we're going to do an imagery rescript, I might come in and say, as I come in and I help you out, I put my arm around you. Is that okay? And so we want to get permission to, in imagery, have touch. But as we do that, we want to really connect them to that sense of touch. Can you feel the warmth of my arm? Can you feel the hand on your shoulder? And maybe even get the client to put their hand on their shoulder as a way of building in touch into the imagery work you're doing. And then as they go about their day, they could use that gesture or that holding of that little finger as a kind of way of connecting with that little part of them that wasn't seen. You do that, I think, sometimes also with using fleeces and other things too, Rita.
Yeah. So I think that's a really good point, Ruth, about, really kind of targeting the lack of touch or affection associated with the deprivation. And one of the ways that you can do that is, yes, getting patients to imagine their little hand being held or something like that. And then perhaps actually in the session physically, perhaps not via telehealth at the moment, given what's been going on, but having a bit of fleece that they hold, and then you kind of perhaps tug it gently so that they have a felt sense of being touched or being comforted by something soothing.
I think one other challenging thing for clients, particularly with emotional deprivation, is they can often find things like reflective listening very difficult. So even though they need to be seen and understood, when you're really trying to connect by going, empathizing with their feelings and reflecting those back, the schema will actually spit it out. So you'll often get clients, saying, no, it's not sad and lonely, it's more angry. And you'll say, oh, okay, so it felt really angry. No, it's not really angry, it's more frustrated. And you can see that yes, but happening. And I think that's the schema in activation. It's like when you're giving someone who's been starved a meal, they will spit it out. They cannot tolerate that level of affirmation. So we can draw attention to that and help them to catch that schema, catch the impulse to spit it out, and maybe even see if we can titrate it so they can tolerate love and connection, maybe with their partner, helping their partner to have lots of non-sexual touching, lots of words that are connecting words, even working with your client to work on a few phrases that they really needed to hear growing up, that if they've got a safe partner, that person could say to them, and that they could practice letting in. Well, that's our 7 minutes, Rita. So we want to encourage people to keep working on these issues, and certainly we offer some training, particularly I guess in helping clients with it, those deep kind of somatic needs for connection and nurture, and we welcome you to come and learn more about that with us.